Good evening. Thanks for tuning in to CMU Public Television. I'm Sarah Adams. Tonight, we ask the doctors. Stay with us. Welcome back. Thanks so much for tuning in to CMU Public Television this evening with our original series, Ask the Specialists. Tonight, we ask the doctors. I'm Sarah Adams, your host for this evening, and we want to invite you to call in your questions for our guests that we have here today. The phone number to call is 1-800-727-9268. Tweet us at WCMU_AskThe, or write on our Facebook page or send us a message, facebook.com/askthespecialists. We do hope to hear from you this evening with your questions for our guests, and without further delay, let's meet them. Dr. Angela Seabright, DO, you are a family practice physician with McLaren Bay Region.
Yes.
Thanks so much for being here tonight.
Thanks for having me.
What types of questions can our viewers ask of you tonight?
So, family practice, primary care, anything you would ask your family doctor. I see all ages, from the very young to the very old. Common questions, really anything you would ask your family doctor.
Okay, well, thank you very much. We also have with us this evening Dr. Ellen Kehoe, DO.
Kehoe, DO, that's right.
Okay, I'm glad I'm not the only one that's done it.
No worries.
You're a cardiologist
Yes,
with McLaren, Central Michigan, and laughter is the best medicine?
Yes, that's true. So you can make any jokes you want. It'd be fine with
Wonderful.
me. Yes.
What kinds of questions can our viewers ask of you?
My practice is only cardiology, which means that I only take care of people with heart disease of some kind or another, whether it's circulation problems, irregular heartbeats, blackout spells. Those would be the more common situations. Not open heart surgery, because I'm not a surgeon. I'm a medical doctor, so I do the medication treatment and send people for surgery if they need it.
Okay.
So things like that is what I do all day long.
Wonderful. Well, thank you both for being here. This is great.
No problem at all.
Again, you're watching Ask the Doctors. The phone number to call with your question, 1-800-727-9268. Tweet us at WCMU_, or visit our Facebook page, facebook.com/askthespecialists. We were talking a little bit before the show about some big topics right now, and Dr. Seabright, I think a big one on everyone's mind right now is seasonal allergies.
Yeah, well, today especially, spring is in the air, and you can take that literally, because we've got the pollen, trees, as we get into the summer, the grass, weed, all of that. And people have allergies to these things, so it's not uncommon to start noticing the runny nose, the sniffly nose, the itchy, watery eyes, scratchy throat. The best thing to do is, you know, if you can, avoid it, but it's hard to avoid the beautiful outside weather. So the next best thing, if you have to, there's a wide array of over-the-counter decongestants, antihistamines, some of the brand names you heard of commonly, Claritin, Zyrtec, Allegra, all of those, people, if you take them daily. And there's also saline nasal sprays. If you have to, if your allergies are really bad, you can see your doctor, maybe get a prescription like a steroid nasal spray just to get that inflammation down. One more tip with that, though, just be careful when you are outside, your clothes are picking up all of the pollen, and you're bringing it back into the house, and you're constantly, you know, exposed to that. So just keep that in mind. Make sure you're washing your clothes, getting all of those allergens away from you.
And probably sleeping with the windows open, not the best plan.
Windows open, and people that still hang their clothes out to dry. I know you love to get that nice breeze in the clothes, but if you have bad allergies, that's not a good idea.
Oh, yeah. Bummer.
Yeah.
Now, for a lot of people right now, springtime is a time where they get back out after the winter months. And you said that for some people, before you jump into a really ramped up exercise regimen, or even if you've been inactive all winter, probably should get a stress test checked to make sure everything's okay.
Yeah. You don't necessarily need a stress test, but you need to talk it over, usually with your family doctor, about whether you have risk for heart disease, and if you do, then you would want to get a stress test before you start exercising. The usual things we look for are whether there's a lot of heart disease in your family, whether you've been a smoker or still are a smoker, Diabetic people have a lot of heart trouble. People with bad cholesterol levels, those would be the main things that we would want to check on. And if you have those problems, then it might be wise to get a stress test before you really go crazy on exercising.
Okay.
So.
Questions are coming in. Again, that phone number, 1-800-727-9268. Do give us a call, and our phone volunteers will take your question for our doctors here in the studio. Caller from Alpena, can it be normal to have blood in the urine?
Blood in the urine, actually that's not normal. So sometimes there can be false positives that can cause the blood, so it's a good thing to maybe get a recheck to make sure that there truly was blood in the urine. Now, I don't know if this patient is seeing the blood, so when they're urinating they're seeing red, or if they just went to visit their doctor and the doctor did a dipstick urine test and found some microscopic traces of blood in there. But either way, it's abnormal. It can be associated with a wide array of things, anything from kidney stones to bladder cancer. So that's definitely something that needs to be worked up.
Okay, caller from Petoskey, a 71-year-old woman recently has a burning pain in her thigh. What could it be? Is it serious? Now, I know that sometimes heart troubles can manifest in many different ways, so let's have both of you chime in here.
All right, well, first thing I think of burning pain in the thigh. Usually when we say burning, it's usually a nerve type of problem, and oftentimes it can be radiating from the back. So I don't know if it's in the front of her thigh or the back of her thigh. There is a common culprit, the sciatic nerve, that would usually cause pain down the back of the thigh. But if there is a burning sensation, you know, she should be checked out, get her back looked at if she's having any back pain, and that would be my first thing that I would think of.
Yeah, I think that is the most common situation. One other thing that I've seen, if it's running down the side or the front sometimes, is that it's the very early sign of shingles, because people get burning where they're going to get shingles, but it usually doesn't, the shingles itself doesn't show up for several days later.
Okay.
So if anything like that that persists, she should get checked out and see if there's something that they should be working on for her.
Caller from Gaylord, should I be worried if my white blood cell levels are chronically high? What does that typically indicate, and what might be that a symptom of?
Yeah, well, your white blood cells are usually take care of infection within your body. So if they're elevated, it's usually your body's way of fighting an infection. Now, if chronically high, I'm not sure if that's something they've had checked numerous times and it's always high. You have to look at the full picture, at the other parts of the blood count. So not only do you want to look at the white blood cells, you want to look at the platelets, the red blood cells, the hemoglobin, because there are some blood disorders that could cause the white blood cells to go up. So usually it's not normal. If it's a transient, meaning it came and went, usually that's your body fighting an infection. But if it's chronically elevated, there could be something else going on.
Okay. Dr. Kehoe, any thoughts on that?
Second her emotion.
Okay, sounds good. Caller from Gaylord, what is the best diet pill available? Now this, you probably both get this question, but diet pills can also have an impact on the heart. So let's hear from both of you here.
Well, if there was a diet pill that worked, you know, we'd all have the answer and we wouldn't have to worry anymore. Unfortunately, they don't all work. Some of them can cause some weight loss, but that doesn't come without some harmful side effects. So if you're thinking about getting on a diet pill, you have to see your doctor, have a physical. I mean, some of these pills have a stimulant-like effect, so that could raise your blood pressure, can cause a whole host of problems. And really, you know, it's not the safest long-term way to lose weight. You really need to change your lifestyle, and that's when you take a diet pill, you're also supposed to change your lifestyle. There is no magic pill. So,
impact on the heart.
Well, first of all, let me say, if there was a magic pill, I'd be taking it, and I would also invest in it, and we would be multimillionaires.
Okay.
But there's not. Unfortunately, we have to do what you have to do, which is eat less than you exercise, essentially, which is a very brief way to do it. The effect on the heart of diet pills, I actually don't prescribe them ever. The older ones, they used to use thyroid supplements. They used to use a version of speed, which anytime your body's going fast all the time, you do lose weight, but it's not healthy. So the pills that are available now, I'm not even sure what they're made out of, but I wouldn't recommend them for anybody because, as she was saying, you just have to change the way you eat. and the way you exercise if you actually want to lose weight and keep it off.
Caller from Traverse City wonders who owns a patient's medical records. Is it a hospital or an insurance company, or is it actually the patient?
The patient owns their own records, always. The doctors sometimes charge for copying them because the doctors are required by law to keep the records of anything they do. For instance, if I order a test, I have to have the results. So the result itself belongs to the patient, but some doctors' offices charge for making copies for the patient to keep. But it definitely belongs to the patient.
Caller from Clarkston. My doctor says I have a low thyroid and wants to put me on medication. Is there a natural way to treat this?
You know, being on a thyroid supplement is probably the best thing that you can do. It depends how low your thyroid hormone is, and it depends if you're having symptoms as well. I mean, usually people that have low or underactive thyroid, they may be really fatigued, they may be gaining weight, they may notice hair loss, they're cold all the time. Those are some of the symptoms, and if you're experiencing those symptoms and you have a lab test that shows your thyroid's low, it's pretty safe to be on a thyroid supplement. Your doctor will monitor those levels. They'll start you on the medicine and maybe recheck in 6 to 8 weeks to see where your levels are, to see how you're clinically doing, if your symptoms have improved. And they just keep a close eye on that to make sure you're not taking too much thyroid hormone, because that could cause another problem. But typically you start low and you just titrate up depending on the need.
A caller coming in through Twitter, a question coming in through Twitter. If my grandmother has Alzheimer's, is it hereditary? And where is there a test to find out if I will get it?
Well, Alzheimer's has been shown to have a genetic link. And as far as testing, I mean, you would have to go through there's no simple blood test. There's no simple scan of the brain to determine if you're going to have Alzheimer's, or even if you do have Alzheimer's. So, you know, I'm sure there are some sort of sophisticated new science, you know, testing that you can do if you want to have genetic testing. I'm not aware of that exactly. It's not common practice to do. But there is definitely, you know, if it runs in your family, there is a possibility that you could have it.
Caller from Fillion is 49, getting a sharp, quick, sudden pain for the past year. What could it be from? This is directed towards Dr. Kehoe.
Where is this pain of which he speaks?
Sounds
Are we
like
assuming chest?
Yeah.
That's usually what people would be asking me about. In most cases, anything that's very sharp and very quick, like a split second, is not a real heart problem. The only thing that's that fast in the heart is the heartbeat itself. So if you say we're having a skipped heartbeat, you could feel a skip, but as far as an actual pain, that's much more likely to be something in the muscles between your ribs rather than the heart. When the heart has pain, it lasts longer than a split second.
Okay, caller from Freeland. What's the best cure for postnasal drip? We talked about this a little bit when we were discussing allergies, but it's something that, is there a cure, first of all?
Is there a cure? I mean, I guess it depends on what's causing the postnasal drip. Is it allergies? Is it chronic sinusitis? Either way, you know, starting with an antihistamine, saline nasal rinses, sometimes steroid nasal sprays, that's probably the best start. So if it's a recurrent problem, you're having the drip, it's coming from the nose, you get recurrent sinus infections, you should probably see an ear, nose, and throat specialist. So.
Farwell has a question about the difference between sinus and allergy troubles. How do you know which is which and what you have going on?
Usually they kind of go hand in hand. So people who have bad allergies usually have problems with their sinuses, because allergies cause, you know, inflammation of the nasal passages, you're really acutely inflamed, you're sneezing, and when you're inflamed, then your sinuses don't drain as well. So then you get kind of the stagnant sinus fluid backing up and you get infections. So they really do go hand in hand. Symptoms are similar. Usually with allergies, you get more of the itchy, watery eyes and sneezing, whereas the sinuses is more of the nasal congestion, but again, they overlap quite a bit.
A caller wondering about the correlation between stress and the heart, and what kinds of impact does stress have on the heart and then the body in general?
Okay. Stress has a lot of impact on everything, and if there were a way to be rid of all stress, that we'd probably all be just dead, because there's really no way to be without stress in your life. The best thing to do with stress is to figure out a way to diffuse it, and one of the best stress reducers is exercise, because when you exercise, it burns off the chemicals in your body that stress has produced. So it's a very, very helpful thing. As far as the effects on the heart, probably the most common effect of stress on the heart is causing extra heartbeats or palpitations. So if people are under a lot of stress, their heart flutters or pounds. Also, caffeine tends to do that. There's some evidence that very long-term stress might contribute to circulation problems, because the insides of your vessels get irritated and then they get plaque on them. But the most common immediate effect of stress would be heart pounding, and your blood pressure goes up.
A caller from Big Rapids wonders what a wrestler with Crohn's disease should eat before a match to lessen his symptoms, addressing an issue with nutrition.
Well, I mean, with Crohn's disease, you have to be careful with your diet. You know, it's an inflammatory bowel disease. These patients usually have problems with chronic diarrhea, abdominal cramping. He should probably already be on, you know, a high fiber diet. It's usually recommended to reduce inflammation within the colon. So, you know, before any physical activity, whether you have Crohn's disease or not, you should definitely stay well hydrated. You should make sure you're getting enough protein in your diet, carbohydrates the night before. But with Crohn's especially, you know, sticking to a high fiber diet is important for a good colon health.
I would agree 100%.
A caller with a question for you, Dr. Kehoe. Please talk about PVCs. How serious can it be? Is there any kind of advice for people who have it?
PVCs are simply one of the extra types of heartbeats. Everybody's heart has a lot of extra electrical cells that they don't really need, and when they kick on, they cause extra heartbeats. PVCs by themselves, if that's all you have and there's nothing else wrong with your heart, those are not worrisome at all. But if someone comes in for the first time, we need to make sure there's nothing else wrong with the heart. And then, assuming that we check the circulation and check the valves and everything's fine, then treating PVCs is based entirely on how much they bother the person. And usually, if they know their heart's okay, the bother of the skips kind of fades off.
Caller from Fenton wondering, will drop feet nerve loss ever get better? Explain to us what that is and some of the symptoms.
So drop foot is just kind of as it sounds. Your foot just is dropped. So as you're walking, you normally try to clear your foot. That foot actually can drag. And usually it's associated, you know, it's a neurological problem. Usually diagnosed clinically, you can see the patient has dropped foot. Sometimes you can do an EMG to detect how the nerves and muscles are firing. And I'm not really familiar with what type of treatment they have for, you know, physical therapy would probably be a big thing as far as managing, you know, your gait or walking and building up strength in the other muscles of your body.
A caller from Sparta has a leaky valve in the right chamber of her heart. What does this mean?
The leaky valve on the right side of the heart often does not end up causing any trouble whatsoever. The right side of the heart is a much lower pressure system overall, and since we have been doing echoes, ultrasounds of the heart over the last 40 years, we're seeing a lot of people whose valves leak a little bit. And a leaky valve is like a drafty door. So it can either be a tiny little draft or it can be a wide open door. And the only time a right-sided one would be serious would be if it was really a severe wide open door. And on a rare occasion, I've been doing cardiology for about 30 years, and I think I've done a right-sided valve repair once. It's very rarely a problem.
A question coming in from Twitter. Does my citalopram for anxiety cause weight loss or weight gain? Did I say the medication name correctly?
Citalopram, I think.
Citalopram,
yeah.
Okay.
So that's an antidepressant. And some antidepressants can cause some weight loss. A lot of them can also cause weight gain. So it really just depends. I'm not familiar with that one. It depends on the person. Everyone reacts differently. Some people may have some weight gain, some people may have some weight loss. Now, people that are depressed, on the flip side, they can also, their depression can cause weight gain or it can cause weight loss depending on how people are responding to their depression. So if you're treating the depression, that could solve either one of those problems usually. So
okay, and it kind of goes back to what you were saying about burning more calories than you're using.
So if somebody's depression is adequately treated, they may exercise more because they feel like doing more, and their weight may start to come off, or vice versa.
Caller from Traverse City wants to know the reason behind the cracking of the bones, popping from the joints when moving. Is this related to crepitus? What would be the treatment? Did I say that correctly?
Crepitus. So crepitus is kind of that crunchy noise you feel as you're moving your joints around. And you know, we all crack. You crack your knees, you crack your knuckles. It is just kind of the movement of the joints there. And usually it's normal unless you're popping something out of place. You know, usually if it's a high-pitched kind of crack, it's normal. If it's a real loud kind of crack, it's a little bit more concerning. So I wouldn't make a point of constantly cracking your knuckles or cracking your joints. You know, you're pushing things where they shouldn't be moving.
Okay. That one's a little hard to even think about. Yeah. The cracking of the joints and things dislocating. So let's keep moving along here. A caller from Ascota has trouble breathing. They don't smoke and they don't have asthma. Any advice?
See your doctor now would be good. I mean, if you can't breathe normally compared to everybody else, something is probably not right. And sometimes it's just that you're way deconditioned and you're not used to moving as much as you should. And your body is used to that level. But if you really feel like your breathing is not as good as it should be, then you should get checked to see if we can make it better.
A caller from Kalkaska has a lot of friends who are constantly tired, but they aren't sick. Could this be weather related, or is that something else? I mean, everybody seems a little bit more sluggish in the wintertime. What kinds of advice would you have?
Yeah, I mean, in the wintertime, the days are shorter, so it gets dark, you know, at 4:30, 5 o'clock. So you're not as active. You're sitting at home, a little bit more sedentary. You're not exercising and getting that little boost of energy. So sure, that can make you tired, but there's a whole host of things that can make you tired. You know, I don't know why this particular group is tired. Usually with an individual, we ask, are you getting enough sleep? Are you getting enough hydration? Are you eating properly? Are you exercising? So a whole bunch of things. You know, you can always check blood work, make sure you're not anemic, make sure the thyroid isn't low. So, but definitely the weather can play a role.
We have just about 5 minutes left, so we'll get to as many questions as we possibly can. Caller from Sheboygan, can blood pressure medicine affect your heart rate, or can antibiotics affect your heart rate?
Blood pressure medicine certainly can. There are approximately 300 blood pressure medications, most of which are various groups, and several groups slow the heart rate. Very few make the heart go any faster, but sometimes people do get a faster heart rate as a response to a medication. So yes, absolutely.
Caller from Spruce, Michigan, what are probiotics used for, and are they beneficial?
Probiotics are basically, it is what it sounds like, probiotic instead of antibiotic, where we stop bacteria. Probiotics are a way to replenish the natural bacteria that we have in our body. We all carry bacteria, and the gut, or the colon especially, has a certain amount of healthy bacteria that helps keep things regular. So probiotics are sometimes given for colon health. It's relatively safe to take, so if you're thinking about taking it, go ahead and ask your doctor. A lot of things in the grocery store may advertise that they have probiotics in them, so just go ahead and ask. It's pretty safe to take.
Caller from Traverse City has just been diagnosed with arterial stenosis. Any diet changes he can make to improve this?
It's probably arterial sclerosis.
Okay.
Just guessing. And that is just that for whatever reason he's developing some kind of clogging in the arteries, whether it's plaque of partially out of cholesterol. So the main things we would do in those situations would be, number one, to not smoke, because smoking makes your vessels spasm and also makes more of the plaque lay down on your vessels, and finding out whether you need to adjust your cholesterol. Some people develop atherosclerosis without bad cholesterol, but it's usually a problem.
Okay. A caller from Farwell, problem with the legs going numb. They can't move them. When this does occur, what is it from? He does have back problems.
Okay, the legs going numb, so both legs?
Sounds like both legs go numb and he can't move them when this happens.
Okay, well that sounds pretty serious just listening to that. And usually if it's coming from the back, if there's a problem, it usually goes to one leg. It's kind of rare to have the numbness going down both legs. So especially if there's numbness in the groin area or if there's problems with, you know, loss of control of your bladder or urine, that could be a major problem with the spinal cord. So depending on how long this has been going on, this definitely needs to be addressed soon.
Okay. Caller from Pleasant Ridge has right ventricular bundle branch blockage, stage 2. How would you take care of this?
Okay. That probably means right bundle branch block.
Okay.
Which means that one branch of the electrical system in the heart goes a little bit slower than the other branches. And normally it doesn't need to be taken care of. Normally it's not a problem, if in fact that's what that meant.
Okay. Time for just a couple of more questions here. Cholesterol lowering drugs, could they also help lower muscular degeneration? We have about 40 seconds
that I'm aware
left.
of. The most common group of cholesterol-lowering drugs are the statin drugs, which are Lipitor, Crestor, Zocor. There's a couple more. They lower cholesterol in the bloodstream. They do not impact the muscle, except on a rare occasion they cause a side effect of muscle pain.
Okay, believe it or not, we are out of time. I want to thank you both for your input and your answers this evening. Dr. Angela Seabright, family practice physician from McLaren Bay region. Dr. Seabright, thanks for your input this evening.
Thanks for having me.
Dr. Ellen Kehoe, cardiologist with McLaren Central Michigan. Thanks for your input this evening as well.
No problem. Thank you.
Thanks to you, our viewers, for tuning in to CMU Public Television. Tune in next week at this same time, same place for a 1-hour edition of Ask the DNR on CMU Public Television. For all of us, I'm Sarah Adams. Good night.